I think the issue of what to do during the school season is really a lot of common sense, and it's what we know now. And it is the same practices that we've recommended over the summer, which is really making sure that people don't go out sick. Parents should monitor their children for flu-like illness, fever, cough, sore throat, gastrointestinal symptoms such as diarrhea and vomiting. And if their children are feeling ill, not to send them to school. Also to watch out for coughing and sneezing and make sure that children know how to protect others by not coughing or sneezing around others or covering their coughing or sneezing. And the same goes true for our parents. So I think just more of a vigilance of symptoms in their children before they go to school during the day, and also to be aware that their child may actually be sent home from school if they have symptoms. It may or may not turn out to be the flu, but schools may have a heightened awareness for sending people home, and also to be aware that if they do get sent home, they might have to be sitting in a room separately from all the other kids until they get picked up. So those are the basic rules right now. Now, if things change and we see lots and lots of influenza, there may be other issues that come up, such as school closures, which we don't really know at this time what different school districts or counties or the state or the federal government may say about that. The American Academy of Pediatrics has recommended that all children definitely get vaccinated for the regular influenza. Now, for some children, that may mean 2 shots for the regular flu, because if children have not been vaccinated in the past, they need to get 2 doses in some situations. And so that'll be a baseline, because we anticipate that there may be circulation of both the seasonal flu and the H1N1. In order to address the issue of H1N1 vaccine, the federal government now and private industry are looking at vaccine trials at this moment. So it's anticipated that there will be a number of different vaccine options in the fall, but what those options might be are unclear at this time. When those vaccines will be ready and for which age groups they will be ready for, we're not sure at this time yet either. But we do think that there's quite a bit of activity at Stanford and elsewhere to look at H1N1 influenza vaccine studies in the next few months. So pregnant women should be especially careful this year, and actually currently as well, because we still have circulating H1N1, to avoid becoming exposed to the influenza virus. And I know it's very difficult because many pregnant women have young children at home who may themselves be infected, so or may become infected. So I think that in general, pregnant women should try to avoid being around others who have influenza-like illness, avoid people who are coughing with respiratory symptoms. But also, if they themselves develop a cough, fever, sore throat, any of the symptoms that are associated with influenza, especially with H1N1, they should call their physician and let them know that they're experiencing these symptoms.